Recognizes the gentleman from Florida, Mr. Grayson, for 5 minutes.
Thank you. 50 years ago this week, President Lyndon Johnson signed the law that created Medicare and Medicaid, the most important health care programs in our country's history prior to the Affordable Care Act. With one stroke of his pen, President guaranteed both poor Americans and older Americans the right to high-quality, affordable medical treatment. Thanks to Medicare, for 50 years now, our seniors have received the health care that they've needed to stay healthy and to live a full life. But despite this success, there are gaps in Medicare coverage that need to be closed. The most glaring gap is the fact that Medicare does not provide basic medical coverage for seniors' eyes, ears, and teeth. It's as though Medicare assumes that seniors don't need to see or to hear or to chew. We're not talking about exotic high-tech treatments. We're talking about no Medicare coverage for eyeglasses, eye exams, hearing aids, cavity fillings, and dentures. We're talking about no treatment for medical conditions that lead to blindness, deafness, lost teeth, and serious gum disease, which has been strongly linked to heart disease. It's unthinkable that we deny our seniors this elementary level of care. There are 2.7 million seniors in America who are blind. How many of them would be able to see today if they'd received a simple annual eye exam as part of their Medicare coverage? Medicare is a promise that we make to ourselves, the young to the old, one generation to the next. The promise is that after you reach your 65th birthday, your medical needs will be met. To keep that promise, our seniors have paid into the system for half a century in some cases before they receive a single earned benefit. They deserve the best care we can provide for them. This week, to honor the 50th anniversary of this life-saving program we call Medicare, I'm introducing the Seniors Have Eyes, Ears, and Teeth Act. This bill will amend 18, the Medicare provision of the Social Security Act, to repeal the arbitrary exclusion from Medicare coverage of eyeglasses, eye exams, hearing aids, hearing exams, and dental care. 2 short lines in the U.S. Code have barred that coverage for 50 years. I simply delete those lines. I urge my congressional colleagues to enact this quick, easy, and necessary reform. Medicare should provide health coverage for every part of your body, including eyes, ears, and teeth. Over 50 million Americans enjoy Medicare coverage. To celebrate the 50th anniversary of Medicare, let's guarantee to 50 million Americans the health care that they need to look into the eyes of the ones they love, to see our 4th of July fireworks each year, and to hear it when freedom rings. Thank you. I yield.
The gentleman